Hi, it's Chris Westfall. Got a lot of news to cover for you today. Some really, really good news with regard to the New York City retirees. Stick around for that. It may impact you as coming to a location near you, but also there's a cancer doctor who's finally speaking out about what he thinks that your choice about Medicare plans should be, and you should hear what he has to say. And then two people that are on one particular type of Medicare plan. I'll try not to mention their name, or the company's name rather, and you should experience what they've gone through just in case you're at the point where you're deciding on which type of Medicare plan would be best for you. If you're not yet familiar, my name is Christopher Westfall. I've been helping seniors with Medicare plans for 26 years across the country now, and I'm a strong, passionate advocate for seniors. My brokerage is called Senior Savings Network, and we charge absolutely nothing for helping seniors with their Medicare insurance needs from, like I said, coast to coast. But today, there's some interesting news I want to share with you about things in the news that have happened since the last time we've done a live stream. And this breaking news is pretty rare. We had a doctor who worked in bone density, orthopedics, before talk about the difference between original Medicare and Medicare Advantage. And now we're talking about an oncologist talking specifically about cancer and cancer options when you're on which type of Medicare plan. Now you'll note that I have on the screen here the QR code. And why is that? That is so you can scan it with your phone by holding up your phone to the screen in the camera setting, like you're going to take a photo, but don't take the photo, let the phone actually see that it's a QR code. And the reason I do that is for full transparency. I want you to be able to see the source of the articles that I'm getting these things from. This article is from July 2nd, talking about the oncologist, but I'll put this throughout the presentation today so you can go in there and see for yourself the things that I'm talking about. And if I talk too fast or move too fast, you can pause and then go back in the video. Is that fair? I just want you to know the source of the news, and it's not just me saying this, as I've been saying for years and years. I want you to have the full opportunity to examine this information for yourself. This article says a local oncologist criticizes Medicare Advantage plans. He says that, and I won't mention the company name, and others are not good for those with cancer. That's all he's saying. That's
the medical director of the Morrison Cancer Center believes the requirements of Medicare Advantage organizations, such as 𝗷𝗫𝗄𝗃, do a disservice to his cancer patients. Dr. 𝗫𝗂𝗃𝗶 feels people with cancer would be better served with traditional Medicare than they are by Medicare Advantage plans. For people with Medicare Advantage, prior authorization is often required for treatments that 𝗂𝗃 feels his patients need. Those measures include MRIs, chemotherapy, and PET scans.
Why in the world am I having automated intelligence read this stuff to you? Because I'm going to get tired of reading so much. There's so much information here.
𝗂𝗃, who is an oncologist, says the pre-authorization burden causes problems for his patients on a regular basis. Seeking pre-authorization is a difficult process, he says, and the delay can be harmful for people with cancer. Rather than sitting there, waiting for pre-authorization, cancer progresses. A delay of 2 to 4 weeks can jeopardize a patient's life, 𝗂𝗃 said. Sometimes a day or two can make a difference. This is why this is so important, he said. With Medicare Advantage, if a doctor uses a procedure or medication without pre-approval, the insurer will not pay. The doctor would have to bill the patient or the hospital. Rather than going that route, the doctor might use a lesser quality or cheaper product. 3 Medicare Advantage programs are available in Nebraska: 𝗷𝗫𝗄𝗃, Nebraska Total Care, and Blue Cross or Blue Shield. From 𝗂𝗃's perspective, 𝗷𝗫𝗄𝗃 is the worst of the 3 for his cancer patients. And I'm not scared to say it, he said. The Morrison Cancer Center is part of Mary Lanning Healthcare. 𝗂𝗃 has offices in Hastings and Grand Island. He is also an adjunct professor at the University of Nebraska Medical Center. Under regular Medicare, standard procedures are followed in the treatment of cancer, using guidelines set out by the National Comprehensive Cancer Network and the American Society of Clinical Oncology. Any approved chemotherapy may be used for Medicare patients without pre-approval.
Under regular Medicare, conversely, and the whole story is talking about Medicare Advantage, but he says under regular Medicare, standard procedures are followed in the treatment of cancer. There is no prior authorization. That is huge. If you know anybody who's gone through cancer, you can know that waiting for weeks and weeks for an insurance company to say yes or no is excruciatingly painful.
𝗂𝗃 says 𝗷𝗫𝗄𝗃 is misleading in its advertising. A letter he received from the company says a Medicare Advantage plan from 𝗷𝗫𝗄𝗃 provides your original Medicare benefits, plus valuable extras. 𝗂𝗃 says that's not true. Cancer patients who are on traditional Medicare do not require pre-authorization. The independent tried several times this past week to contact UnitedHealthcare, but those attempts were unsuccessful. Two members of 𝗂𝗄's staff spend a lot of time trying to obtain pre-authorization. The process is time-consuming. Some staff members refer to Medicare Advantage as Medicare disadvantage. Not only does UnitedHealthcare deny treatments, but it sometimes denies investigations and tests, 𝗂𝗄 said. This has to be corrected, 𝗂𝗄 says of the current system. If authorization is denied, the physician can appeal the process by requesting a peer-to-peer interview with a doctor. 𝗂𝗄 uses that process frequently, but he's disappointed that he can't argue his case with a fellow oncologist. Sometimes, in lobbying for his patients, he might be talking to a dermatologist or a pharmacist. The appeal process takes time. Members of a cancer team must be aggressive in fighting cancer, 𝗂𝗄 said.
And the doctor that worked in orthopedics, if you recall, she talked about the exact same thing. They say you need to do a peer-to-peer consult, and she could be on the phone with somebody who has absolutely no idea what they're talking about. By the way, if you're liking any of this information or the relevant news about Medicare is important to you, make sure you stick around to the end for the exciting news about New York City and a prescription drug mandate coming out by Congress. Hopefully that'll get done to reduce the cost of prescription drugs. But please take a second and like this video and make sure you're subscribed with the notification bell so you'll know about future updates and all the news having to do with Medicare. And please share this information, share this channel with somebody who's considering what their Medicare options would be. So here's a dirty little secret. This is some stories about people who made a decision to go one way or the other on their Medicare route. Now, I'll just tell you, I have to be completely unbiased here and let you know that we help with all the different Medicare plans. If you want a Medicare Advantage plan, we'll help you with one, but we'll look for one that best lines up with what your goals are. Not just talking about zero premium, but one that has your doctors and your hospitals the benefits that are most important to you. That's critical. Or if you want a Medigap plan, a Medicare supplement, those are standardized. The same thing from New York down to North Carolina over to California. A plan G is a plan G, a plan N is a plan N. But what we do that's different is we'll shop the entire market, find the best value. Since those plans are the same, the only difference is on the price. But let me share with you what some people experience on their Medicare Advantage plan. And again, you can scan this on your phone, so you can go actually right to the article. This is from the 𝗲𝗿, care denied, the dirty secret behind Medicare Advantage. And as things come out in the news, that's where you're going to find them first, is right here on this YouTube channel. And it says in the subtitle, as Medicare becomes increasingly privatized, patients are speaking up about these for-profit insurers' widespread practice of denying treatments that they need. 𝗫𝗁, it tells a story, was so tired of having her care denied by her Medicare Advantage insurer that she considered signing a do not resuscitate order. She's just done. There was no more hope, she said. There's nothing left for me to hope for. She was a former EMT from New Hampshire. She went on Medicare, the government program for those that are seniors or disability, after breast cancer diagnosis left her unable to work. Like an increasing number of Medicare beneficiaries, she ended up on a for-profit Medicare Advantage plan. She ended up on that because she's under 65. And under 65, there are just not that many options in all the different states as to Medigap plans, because those are offered based on state law to someone under 65. Now, over 65, they're in every state. But under 65, it's up to state law whether they offer Medigap plans, Medicare supplement to original Medicare, for those people under 65. And even if they do, they could cost, as in some states, like 3 times the cost that it would be for a similar person on 65 years old. So this was her only option. So she was on a Medicare Advantage plan. A marketer directed her to an option administered by this company that I won't mention any names. But instead of finding the program a relief, she said that this company constantly rejected or second-guessed the care options of her doctors, suggested that her cancer recovery, her doctors suggested for her, and for a rare and painful secondary disease that has no standard treatment plan. Quote, there's a lot of ways that they deny stuff you need. So many times I had the opportunity to try different treatments and medication. The response was, they won't cover it. The reason I have this little website down there, MedicareOnDisability.com, that's my website to help those people that are under 65 years old to realize what those options are. And again, Medigap, Medicare Supplement, which is the premier way that you can get your health care delivered with no prior authorization, no networks, nobody denying your care if it's medically necessary and your doctor says you need it. Those are not available in all the states if you're under 65. Good news is, when you turn 65, you get another open enrollment period. You could choose a Medigap plan at the very best rates available at 65 years old. But I cover all that on that website down there. If you know anybody that's coming up on their 2 years on Social Security disability, Medicare is going to be an option. And what they decide then can be critically important. So I cover that at that website, MedicareOnDisability.com. This company's routine denials led her to frequently end up in the emergency room. That can't be cheap, folks. And she eventually became so sick of struggling through the system that she nearly waived her right to be resuscitated if her condition was irrevocable or recoverable. Mentally, it was very destructive, she said. I've been an EMT and worked in a hospital. I knew there were treatments, but never thought about not having access to the treatments. Her experience transformed her views about Medicare Advantage. She's also a former two-term Republican state representative in New Hampshire who, like many GOP faithfuls, believed that private insurers could solve the healthcare crisis if they were allowed to do things like sell policies across state lines. Now I realize that you can't fix or repair this system. The insurance companies don't offer anything. They serve as roadblocks. The only way forward is Medicare for all. That would be nice, but it's not going to happen. Coffey's not alone, as the privatization of Medicare via insurer-owned Medicare Advantage plans expands to nearly half of Medicare beneficiaries now. Actually, it's more than half. 31 million people. Care denials by Medicare Advantage are threatening the foundational premise of the government's healthcare safety net for seniors and people with disabilities. That people in Medicare should get the care that is recommended by the doctor. Say it ain't so. A 2022 investigation by the Inspector General found that in 2019, 13% of the prior authorization requests were just flat out denied by Medicare Advantage plans, and they would have been covered under traditional Medicare, again with a supplement, or just traditional Medicare. That led to an estimated 85,000 additional care denials. That year, Medicare Advantage plans also wrongly denied 18% of payment claims. That only covered 1.5 million claims, reducing the likelihood that doctors will recommend the costliest yet most effective care for fear of not being paid. Who wants to not be paid? In the subsequent 2 years, total Medicare Advantage enrollment increased from 22 million then to 27 million. Such denials have reportedly skyrocketed. A February report from the Kaiser Family Foundation, a nonprofit group, found that 2 million prior authorization requests had been denied by Medicare Advantage in 2021, more than triple the prior authorization requests for those plans that they denied in 2019, according to an estimate from the IG report. These care denials are helping drive record insurer profits. Coffey's insurance company made more than $14 billion in profits in 2022, and the other three largest for-profit Medicare Advantage insurers pulled in an additional $10 billion in profit. But these denials have disastrous impact for ordinary people's lives, as detailed in numerous patient stories shared with 𝗲𝗏, where this article is found. And the total instances of denied care are likely vastly understated. Kip Sullivan, an independent healthcare policy analyst active in Medicare for All groups, said that denied care in Medicare Advantage was grossly understudied problem, and that many instances go entirely unnoticed. It's a primary reason for why we should terminate the Medicare Advantage program, he said. There are just not enough cops with nursing degrees stationed in emergency rooms across the country to detect this kind of abuse. Coffey's story is not unique. Bob White, shown here, a 56-year-old former blue-collar worker living in Texas, spent a decade ago working in a construction company where he worked with toxic chemicals. Sorry, what am I doing here? That's live, folks. Worked with toxic chemicals without proper protective equipment. The exposure left him with severe chronic pain, agony so significant, he's elected to have significant outpatient procedures done without anesthesia. Have you ever heard of anybody going through pain like that? Since the level of the pain matched his normal levels of pain anyway. He's been enrolled in a Medicare Advantage plan administered by the insurance company for the last 10 years since he became eligible for Medicare due to his disability. Again, many times there's just not a choice. Prior to him moving from Minnesota to Texas, doctors had put him on a pain pump. But to have it installed, he had to travel back to Minnesota because of his network. Because White's pain pump kept failing, he needed a solution for his pain problems closer to home, and he found a ketamine clinic. Now, don't freak out yet. A ketamine clinic recommended by the doctor as an alternative solution. I thought it was hocus pocus, he said, of the ketamine treatments, but within a week, it was working better than anything I had since I got hurt. The best I ever got on fentanyl was an 8 on the pain scale, and ketamine got me down to a 6. Here's the interesting part, folks. Traditional Medicare covers ketamine infusions for severe chronic pain. Did you know that? Compensating ketamine providers $300 per session under standard Medicare rates. That's traditional Medicare. However, the Medicare Advantage plan he was on pledged that they would cover his infusions, but then said they'd abruptly stopped with the treatments. When they pulled their stunt and said they weren't going to cover it, my blood pressure went through the roof, he said. Now I'm stuck on fentanyl again. Care denials are a feature, not a bug, of Medicare Advantage plans. Traditional Medicare was founded on the principle that seniors and disabled people would get the care they need most because it covers care without an insurance middleman, instead making set payments directly to the healthcare providers. Many people don't know this, but Medicare supplement companies, Medicare supplement plans, Medigap, they cover what original Medicare covers without a person deciding if it's covered or not. The person who determines if it's covered or not is original Medicare. So when Medicare pays the claim, the supplement company automatically pays that claim. Did you know that? That's under traditional Medicare, not Medicare Advantage. But by creating Medicare Advantage, Congress inserted private insurers into Medicare who have an inherent incentive to deny care. Why? I've said this before. The less medical attention they provide beneficiaries, the more government money they can pocket as profit. Not me saying it. Medicare Advantage options also limit critical care by requiring prior authorization on an array of services. Now, this QR code is different. This is talking about, this links you to the story that they espouse here from the Center for Medicare Advocacy. It talks about prior authorization, what it is, and why it's so costly to people's health. And I encourage you to scan that. If you've not yet done it, you can pause it and come back to this. Read that whole study by the Center for Medicare Advocacy on prior authorization. But back to the Lever story. Richard 𝗫𝗿𝗁, the former CEO of the nonprofit hospital Trinity Health, said that prior authorization has led to built-in delays in care, resulting in far worse prognosis for the patients. And he ran a hospital system. Imagine that. Quote, "We've built into our whole system of care that we're going to have to give insurers a week or two to pre-authorize care." That's insane. White said that he's appalled by this company's need to line their pockets and to cause such widespread physical and mental pain to do so. And he fears for the potential end result. "I wonder how much it's going to cost this company if I had a stroke," asked White. "It's going to be a hell of a lot less to give me just the ketamine." This company, talking about, made $2.8 billion in profit in 2022, and its CEO made over $17 million a year in salary. "I'm pretty much trapped," he said. In late 2020, Rick Timmons, shown here, a 75-year-old retired veterinarian from Seattle, discovered a small discolored lump on his ear. His primary care, that's in Medicare Advantage, they have to get a referral now, remember, to go to a specialist, referred him to a dermatologist to conduct a standard biopsy. But he faced unexpected obstacles thanks to his Medicare Advantage plan. Unlike traditional Medicare, again, the difference, unlike traditional Medicare, Medicare Advantage plans are based around provider networks that force patients to choose the healthcare providers selected by the insurance company, or else they face potentially enormous financial penalties. Yeah, like no coverage at all. That meant that rather than getting the best care from the most experienced doctors of his choice, his plan outsourced its claims processing and determinations to a healthcare services company called Optum, which is a subsidiary of another company I won't mention. This company repeatedly gave him the runaround, turning a minor diagnosis into a serious health problem. "I would call every week, and the customer service agent would say that they're having some sort of problem," he said. Good gracious. "The little lump tripled in size, very painful. It was malignant melanoma that had become pretty aggressive. Again, with the cancer and how they're treating you. 7 months passed before he was treated. 7 months. In a statement, the Medicare Advantage company said, "It is always our goal to ensure that our members can access quality care that best fits their needs in a timely manner. We are disappointed that this member's experience did not meet those expectations. By golly, he just didn't quit." So they ultimately had to pay for it. Now in remission, Timmons is that was my own commentary, sorry. Now in remissions, Timmons is facing a new challenge for his recovery, as the Medicare Advantage plan may no longer cover his doctors at UW, a medicine healthcare system. I just got a letter saying that they're in contract negotiations and I better be prepared to find a new provider. Talked about this before. Just because your Medicare Advantage contract runs January to December does not mean that the provider's contracts run January to December, and they can leave those plans at any time. So you better not bank the whole house on the fact that who's in your plan when you sign up for it will be in your plan for the duration that you're on the plan. But I digress. This company concluded negotiations with UW in June, but because Medicare Advantage plans always use provider networks that the HMO versions do, there are no guarantees that future contract negotiations will ensure that those doctors remain available to the patients with this plan. Right. He pointed to another major issue with Medicare Advantage plans, and that is patients on traditional Medicare nearly always purchase Medigap plans. That goes with traditional Medicare, which provide full supplementary coverage to Medicare, as traditional Medicare covers just 80% of care costs. Couldn't have said it better myself. But in most states, Medigap plan insurers are allowed to reject patients or discriminate against them by charging them far higher premiums based on pre-existing conditions after they've elected first for a Medicare Advantage plan due to a loophole in federal law. It's not federal law, by the way. That's state law that dictates whether or not underwriting is required. So once a patient enters the Medicare Advantage system, they typically cannot afford to leave. And unfortunately, Mr. Timmons does not know our agency and what we do. We specialize in getting difficult cases through underwriting. That's why we contract with dozens of insurance companies and don't represent just one. It's critically important that even with his case, for instance, he had cancer, 3 years ago? If he had cancer 3 years ago, he can apply for any Medicare supplement plan right now and get approved if that's his only problem, his only condition. We know what that guideline is. I can tell you right off the bat, I didn't make a code for it, but if you go to seniorsavingsnetwork.org, there at the top, /underwritten, spell it all out, seniorsavingsnetwork.org /underwritten. I go through exactly what that underwriting process looks like, give some examples, and we can help by booking an appointment there and seeing if a Medigap plan, Medicare supplement is available for you. And in some states, you can just get on one every year because of the state law. Again, this is driven by state law, whether they require underwriting or not. But he says, I'm stuck. I can't change to another Medicare Advantage plan at this stage. No, you can't, except for the annual enrollment period. I can't go back to traditional Medicare because there's no way that accept me for Medigap. So it would be outrageously expensive. No, it just wouldn't be available, not expensive. But again, if the cancer was his only issue, we can get that approved. And then once it's approved, there's not a pre-existing condition exclusion because he already had coverage. Saying people are dying. In May, the Senate investigation held we already talked about that. We showed it on this channel. A month before, Center for Medicare and Medicaid Services proposed a new prior authorization rule. Right, we'll see how that goes forward. So if you've had any conditions like these or know of any stories, please do me a favor and leave it in the comment below. I want to hear your stories, not your questions about would I be covered. Don't put that in comments on YouTube. It may take days or weeks for our staff to see the comments on YouTube. There are literally thousands of them, but you can share with other patients, those considering Medicare plans, what your experience has or has not been with those plans. That's what the comment's for. If you need some help on your particular case, by all means, reach out to us. We'll be happy to help you. Prescription drugs, what's happening there? Won't bore you with it because it may not go anywhere, but Senator 𝗵𝗿 𝗫, a Democrat in New Jersey, has teamed up with Jim Langford from Oklahoma, trying to get this law passed, which in essence would rein in the pharmacy benefit managers acting as the middleman and driving up the price of drugs. Here they are in their own words.
Afflicted with crippling rheumatoid arthritis. This critical medicine can cost patients more than $80,000 a year. It should be good news to consumers that 𝗍𝗏 biosimilars are being launched, which should make the treatment more affordable for patients who desperately need it. But because the economic incentives to PBMs are completely skewed, the biosimilar drug launched with two different prices, one with a high list price and large rebate, one with a low list price and lower rebate. So take another look at this chart. We know PBMs favor the high list price in order to obtain larger rebates, even though the patient would pay significantly less if PBM selected the drug with the lower list price.
Again, hopefully this is going to change that. We'll see. But I want to share with you the best news of the day. This is an update from New York City and what just happened literally today in court. For those not familiar, the retirees of the city of New York, over 250,000 people, have been going through the city trying to save money on them by pulling them out of original Medicare, taking away their Medicare supplement, and shoving them into a Medicare Advantage plan that they don't want. Although other caveats have been made on this plan to make sure that it's a PPO so they can go anywhere that they want to if the doctor would accept it, and they lowered their max out of pocket. They know how Medicare Advantage works because they've done their research, and they just simply don't want it. So they've been picketing, they've been protesting, but most importantly, they filed a lawsuit. And the lawsuit, you can see the text of the lawsuit right here by scanning this one. And this link takes you to the New York City retirees page run by 𝗲𝗄, and she is amazing. And here's the latest news, actually what happened today. Check this out.
We are announcing officially that our restraining order was granted on multiple counts by Judge Frank today. The decision is posted on the docket. What does this mean? This means that everything stops. You do not have to do a waiver. You do not have to buy a Medigap plan. You do not have to opt out. You do nothing. Absolutely everything stops like an emergency brake pulled on a train. We're going to call it the Jake break. So you do nothing. Now, what you are going to need to do is for those people that were seeking to purchase Medigap plans or who already had, even though we told you not to, because this was our fear, you are going to need to find out what you have to do to make sure that you don't go into those plans in September or defer the dates. We do not know what's going to happen after that. Now, what happens is this whole thing stops. And now the judge will have to set a schedule to actually hear the merits of this case. I can't tell you when that's going to happen. I can't tell you the procedure, the schedule, nothing. So if for those people that already got themselves into an outside Medigap plan for September, you need to contact those plans or brokers and find out what you need to do to pause that or walk it back. For everybody else, you don't have to do anything. You don't have to send in that waiver. You don't have to send in your opt-out. You do nothing. Everything stays the same. The health plans you are in today stays the same. Whatever plan you are in stays the same. So that's our news of the day.
That is.
I could not be happier for the retirees in the city of New York. We're going to wait. We're going to watch this. We're going to update people at nycoptions.com. If you've not yet signed up for the email there, make sure you do. But first, there's a new scam affecting seniors, and it's important that you know about it. For those that don't know my background, I worked at the sheriff's office for the first half of my professional life, and my last job that I enjoyed the most was as an investigative sergeant. I would, from time to time, be able to give speeches to the public about the latest scams and things affecting seniors and little kids and worry about what's coming out there. And this is one of those, and that's why I feel it's important that you know about it. This is artificial intelligence at its worst. Make sure you watch this.
My car broke down. I need you to send me money right away.
Honey, are you okay? Where are you?
Mom, there's no time. Go to the gas station and buy me a Visa gift card and give me the numbers.
What's the code word?
What? I can't hear you.
Beware of this AI voice cloning scam where it sounds like a family member or friend, and it even looks like it's coming from their number. The red flags are it's an emergency and they need money right away. Create a code word with your family members or call the person back.
And if you don't want to make a code word with your family, ask them specific questions that only they would know. If you think it's your child, you think it's your grandchild, they could have simply cloned their voice. I tried this myself with the voice cloning thing. You can take any clip from YouTube about anybody out there, and this will let you type in and speak in my own words or anybody else's own words. So you can't believe your ears these days if you're hearing things, especially if it's somebody calling, asking for money and pretending to be somebody else. Just ask them something that only your people would know. This is my contact information. If we can help you in any way, please do reach out to us. If you click this one or just highlight your phone over this contact thing on the QR code, that can call us directly. You can leave a message with us 24 hours a day. We stand ready to help you with any of your Medicare questions and how we can help you or somebody that you know that's on Medicare. Some of this information is critically important. There are some people making life-changing decisions right now that they may be stuck with for their whole entire lives. Or if you're on a Medicare supplement plan, you're on a Medigap plan, you know it's the best coverage out there, but you don't know how you can stinking afford it because it's gotten too expensive. You should have been reviewing that with your agent, with your broker, at least every 2 years. We try to reach out to every single client that we have all year long so we can review the plans with them because these companies are very competitive out there. And just because you're with a name brand carrier does not mean you should stay with that carrier for your whole entire life, especially with Medigap plans. A Plan G is the same thing as a Plan G in North Carolina as it is in California, in Florida as it is in Seattle. So wherever you are, whatever plan you're on, you should at least shop your Medicare plan every 2 years on a Medicare supplement plan, and we can help you to do that. It doesn't cost anything. You don't have to pay if you're not approved. We can tell you based on your health, your conditions, whether or not you'd be approved and whether it's even worth applying. It doesn't cost anything to apply. Again, we can help you, and our service is 100% free. Thank you for watching. God bless you, and we'll keep you tuned in on what's the latest with Medicare. Make sure you subscribe, notification bell on for all the future announcements, and please share this video and give it a thumbs up. Thank you. God bless you. Bye-bye.